Hello, my name is Sarah Church. This is my culminating quality improvement project for the entry-level Masters of Nursing at Pacific Lutheran University. My project was Improvement Opportunities for Postpartum Quantitative Blood Loss Performance. I did my preceptorship with Peggy Vischer, clinical nurse specialist at the Family Birth Center at St. Michael's Medical Center in Silverdale, Washington. When Peggy and I started in February of 2020, the Family Birth Center had recently implemented the new process of quantitative blood loss, or QBL, after birth. Between July and December of 2019, we found there were 43 births with a blood loss greater than 1,000 milliliters. 1,000 milliliters or more blood loss is what American College of Gynecologists and Obstetrics, or ACOG, considers to be postpartum hemorrhage. This caused us to want to look deeper at the newly implemented process. Using the framework of Plan, Do, Study, Act from the Dartmouth Institute for Healthcare Improvement, we deemed that we were in the study portion for this framework and moved forward with a plan to gain understanding of how the process was working so far. With the consideration of distance learning due to COVID-19 restrictions, we crafted a survey to gauge RN perceptions of the QBL education, clinician knowledge, standardization, facilitators, and barriers to performing the QBL process. The survey was completed by 23 or 30% of the total labor and delivery and postpartum RN staff at the Family Birth Center. The results of the survey were pretty clear. The RN staff had knowledge deficiency on stage-based terminology for QBL. In other words, there's a stepwise set of actions taken at certain incremental levels of blood loss. The survey contained questions related to the stages of hemorrhage, those stepwise sets, and the RN staff scored the lowest on clinician knowledge questions and rated stage-based terminology as a barrier to the process. The suggestion for this area of improvement is to provide more education on stage-based terminology for QBL, or provide visual sheets like laminated sheets with stage-based information for reference at the bedside. Another standout barrier was provider-nurse interaction. In several questions, RNs indicated the lack of provider buy-in or providers' unstandardized way of completing QBL made the process more difficult to complete. However, conclusions about nurse-provider interactions can't be made from the survey alone. This is a preliminary look at QBL and may drive future quality improvement projects. More data is needed from the RN staff to get a bigger picture of the situation and from providers themselves. The providers may have their own perspective that must be considered before making any changes. There was a clear facilitator or thing that helped the process, and that was support staff. Several nurses and managers were called out by name in the surveys as being helpful and generous with their facilitation. There was also a provider called out by name as a champion of the QBL process. Staff support and champions as facilitators is congruent with the Seacrest et al. 2018 study regarding facilitators and barriers in the postpartum hemorrhage bundle, which includes QBL. It suggested to cultivate relationships with personnel and champions to continue this as a facilitator. Overall, St. Michael's Family Birth Center has areas of improvement and further study in stage-based hemorrhage terminology and nurse-provider interactions. And they excel in internal staff support for implementing the new process and should continue to cultivate that resource. I want to thank my preceptor, Peggy Vischer, for graciously continuing to support my preceptorship despite the many challenges presented during the COVID-19 pandemic. Thank you to Dr. Wallace for supporting me during my project creation and review. And thank you, Dr. Schwink, for your clinical support. And of course, thank you to the St. Michael's Family Birth Center staff. They made me feel at home despite all the challenges they were going through. And of course, thank you for listening.